Hello, dear students. I'm pleased to welcome you to our outpatient therapy circle, and we start the first lecture about prevention activities in outpatient practice. Today we will speak about healthy lifestyle and how we can prevent different disease development. So it's very useful information not only for your future work as a doctor, but also for your future as a person. We will speak about very common problem which can be a reason of any disease development. So today we will speak about healthy lifestyle, the basis of primary prevention. So first of all, what is healthy lifestyle? We will speak about this topic during two lectures, today and in the next time, and also continue to speak about it in practical lessons. It's very important save health, not to treat any disease, but to save our health, be more active as long as possible. So we will devote to prevention. At the university, in the most department, you study pathology, specific diseases, and also we will speak about them. But during our circle, we will concentrate on disease, not on disease, but how to prevent them. Believe me, a very important part of the work of a doctor and medical service is disease prevention, in order not to have to treat them. A person should remain active, healthy, full of energy and strength as long as possible, and for this he must make an effort. Here we need not a magic pill but systematic approach. Our goal is to educate the patient and help him with motivation to adhere to a healthy lifestyle. Today's lecture will be devoted to this topic. And I really hope you find this lecture rather interesting for you. The topic of healthy lifestyle is covered with so many myths and that very often you can find diametrically opposite recommendation, and it's easy to get confused in them. If you open Instagram or another network, you will see absolutely different, sometimes absolutely not scientific recommendation about healthy lifestyle. If you ask any question, any person about his lifestyle, he will tell you that his nutrition is correct, but some people are vegetarians, some people eat a lot of meat, and both of such persons will think that their diet is normal. So there are a lot of mythology about this topic, and today we will try to speak about the most common problems that can appear when you start learn healthy lifestyle. So main directors of work of a district doctor or general practitioner or family doctor is absolutely the same terms. Yes, there are some specific features in different countries. For example, in some countries, family doctor works only with rich people with narrow amount of peasants. In another, there is no such connection. In some countries, family doctor works with children and adult, when general practitioner works only with adult. But naturally, by definition, general practitioner and family doctor means absolutely the same things. This is district therapeutists who work in outpatient department. It means not in hospital. And generally, this specialist works as with babies, children, teenagers, adult people, seniors, old people, so with all generation. So what we include in our scope of work? First of all, this is therapeutic and diagnostic work. When people come with some complaints, when we make decision what exact disease they have, this is diagnostic and therapeutic work. When we prescribe some medicine, some drug, it's also therapeutic work. Sometimes it's necessary to give sick list. Person should stay at home. And for example, in our country, Expertise of temporary disability is a very important part of work of district doctor. Patient can't stay at home just by his will, or he will not take any salary. And for official documents, we speak about expertise. Sometimes when we see that it's not temporary disability but constant, we speak about invalidization, and it's also rather important to find this moment as early as possible. Some prevention activities, for example, vaccination, education of our patients, is also rather important. Medical rehabilitation is not only a drug, but some physiotherapy, working with psychotherapists, um, and so on. Advancing of proficiency and skills is very important. The medicine and science really not stay in the same position. Every half of a year, the knowledge, the information in medicine increases into time. You can imagine how fast our knowledge can be increased. Surely one person can't know everything, but we should try to learn new guidelines, new recommendations, and use them in our practical life, improve our skills. We should analyze our work and analyze what mistake we made, maybe how our work can be made better than we did, and it's very important for planning. So, as you see, the doctor's work includes not only a conversation with the patient, but also a number of other tasks, including planning, working with documents, and believe me, it takes a very big part of our work. If we speak about the structure of primary care services, if you look at this picture, prevention is always the foundation of it. And only in case when it wasn't successful, we turn to diagnosis and treatment. When the disease already develops, a person may need rehabilitation. With decompensation of the main disease, emergency care and more intensive therapy may be required. So, as you see, the basic prevention measures, we should work to improve education of our patient about health topic. Then, if disease happen, we prescribe treatment and sometimes rehabilitation, sometimes emergency necessary, sometimes we provide some anti-epidemic measures. If person can't recover, we will use palliative care. It means that we improve quality of life of this person, but we not influence on disease. It's too late. For example, when we speak about oncology or something like this. So, prevention is our basis. So, it was introduction. Now about exact points which we should discuss. The first one is concept of prevention, the purpose of it, main directions of prevention work of district therapeutics, health and its criteria, healthy lifestyle. We will speak about what is normal optimal physical activity, some words about nutrition, and some words about methods and means of hygiene education of our population, and the concept of risk factors. So it's our plan for today. So let's start. Prophylaxis can be medico-social and can be medical. Social prevention in medical context. This is major function of the state that ensures availability of people of all the necessary conditions for health promotion and healthy lifestyle. Prevention medicine consists of measures taken to prevent diseases or injuries rather than curing them or treating their symptoms. This contrasts in method with curative and palliative medicine and in scope with public health methods which work at the level of population health rather than individual health. So, there are some different types of prevention. Depending on the state of health or risk factors or significant pathology, they can be primary, secondary, and tertiary. Primary prevention, this is all what we do to prevent disease, a harm before they happen. For example, vaccination, or when we make any screening test without complaints of this person. For example, we make chest X-ray for all medical staff, for teachers, for students, because in our territory tuberculosis is not so rare. And for screening tests, we make chest X-ray without any symptoms, and it will be primary. If we speak about some group of people who have some risk factors like smoking, some small changes in condition, some complaints, and we make screening tests. Because of age, because of risk factors, it will be secondary. And early detection of disease or complication of this disease. Future it means treatment, rehabilitation, and healthcare management if disease already happened. So, in other words, primary prevention is any intervention that prevents the disease process from ever beginning. Secondary identifies and stops disease in early stage before patient even realize anything is wrong, before complaints appear, before any clinical signs arise. Future prevention is intervention that is used for patients who already have clinical signs of the disease. The intervention attempt to care a patient, decrease morbidity, decrease mortality, decrease risk of hospitalization, and increase functionality. So, some more words about primary prevention. It includes methods to avoid occurrence of disease. Vaccination, for example, rational work and rest, good nutrition, physical activity, something about environment, and so on. Most population-based health promotion efforts are this type. And now about some examples. Education about good nutrition, the importance of regular exercise, and the danger of tobacco, alcohol, and other drugs. Education and legislation about proper seatbelt and helmet use, regular exams and screen tests to monitor risk factors for illness, immunization against infection disease, controlling potential hazards at home and its workplace. So, as you see, it's not only medical task, it's not only doctor um, necessary. It's not only for us as doctor necessary to speak about it. This is also governmental level to make life more safer and healthy. Yes, but also doctors, medical establishments should work to give this information for people to prevent disease before they happen. If we speak about secondary prevention, it includes methods to diagnose and treat existing disease in early stage before it causes significant morbidity. So this is complex of measures and to work with some risk factors. For example, with smoking, with high blood pressure, with insulin resistance, and so on, which can cause some complication, emergence in future. And here, one of the best methods is preventive screening test for finding the early stage of disease and treatment. Some examples of it for better understanding. For example, if person already has had myocardial infarction or ischemic heart disease, it's necessary to use low dose of aspirin to prevent new episode. We recommend to use statins for people who suffer from cardiovascular pathology and suffer from high level of cholesterol. This is not treatment, but this is prevention of new episode. of myocardial infarction or something like this. We recommend regular exams and screening tests who already has some risk factors of this disease. Not like for everyone of population, but for people who already have some risk factors of exact pathology. When we speak about tertiary prevention, we speak about work with people who already have disease. And we reduce negative impact of this disease to health of this person. We reduce related complication. Mostly we speak about rehabilitation and treatment here. It's our aim prevent further prevention. Yes, sorry for tautology. So primary and secondary should be more active. But if disease already happened, we use some rehabilitation program. For example, cardio or stroke rehabilitation program. Chronic pain management program. We not treat the main disease. It's already happened. But we improve quality of life. We improve possibility to move, to live without pain. We speak about health school for people with some pathology. For example, in our country, we have special schools for people who suffer from diabetes, of hypertension, and so on. People once time per month come to polyclinic and doctor work with group, not individual, but with group. People see each other. Firstly, it's also important. They see that they are not alone who suffer from this pathology. They can ask any question, and if person knows better what exactly means his disease, how he should control, what he can do to prevent new episodes or any complication development. It will be better. So, if we speak about tertiary, we speak about disease. If we speak about primary, we speak about health. And secondary is something between. And now some more exact examples. For example, diabetes. When we speak with healthy people, that their nutrition should be correct to decrease the amount of sugar. For example, time of taking meals should be regular. This is prevention. But, for example, person has bad anamnesis, family anamnesis. Some person in his family suffer from diabetes, for example. And doing blood glucose screening tests without pathology, person don't know that he has diabetes, but he has risk factor of it. When we make screening test for it, it will be secondary. And if person already suffer from diabetes, to decrease onset and severity symptoms of it, to treat and prevent complication, it will be tertiary. I hope it's clear. Now, if we speak about medical prevention, we speak about community prevention and individual prevention, so different levels of it. Community prevention is a system of social, economic, educational, sanitary, epidemiological, and medical measures which government use to decrease effect of risk factors, reduce its effect, which can cause some pathology among people. If we speak about individual prevention, it means that we do some complex of measures exactly for this person. Yes, not for everyone, but exactly for this individual level, for this exact person. For example, general prevention, environmental protection and improvement, promotion of healthy lifestyle, dispensarization population. Dispensarization means that we take person under control, ask him to come for physical examination 1 time per year at least, or when he has any pathology. We do some screening tests for him, for everyone. Not exactly for this person, but for everyone. And this is dispensarization. If we speak about special form, for example, vaccination, yes, or some amount of research, laboratory intermittent method of research for people who already suffer from some pathology. Next moment, health promotion. It can be again in population level or individual. For example, when person come to you for consultation, you diagnose some condition and you give exact special recommendation for him. It will be individual education. If we work in groups, if we write articles for mass media, this is population level. If we speak about vaccination, there are some vaccinations that are obligatory. There are some vaccinations that can be recommended for special group of people. For example, here, vaccination against diphtheria and tetanus, against rubella, HPV, obligatory, and most of them made one time per life or just one time in 10 years. If you speak about such vaccination against influenza, person should repeat it every year, and doctor should send patients for this for this vaccination. If we speak about education, hygiene education, how we can do it, it can be oral propaganda, something like lecture, conversation, conference, instructions, seminars, and so on. Mostly we speak about written form of propaganda. It can be some books, paper, journals, articles, calendar. When you come to polyclinic or hospital, you can see some pictures, some tables. Yes, which also show you some information about some pathology. It's a picture propaganda, but mostly we speak about combination of this. When we see tests, when we see some picture, yes, and so on. For example, when we speak about very common pathology nowadays, coronaviruses, everyone know how it's dangerous. But firstly, when we start teach people that it's very important to wash hands, to wear mask, don't forget about distance. Yes, we can repeat it orally rather often, but when patients see everywhere some signs of it, when you go to show pharmacy, polyclinic, hospitals, and so on, some pictures, some text about it, uh, even if he know, but he see it, it became easier for him to control that he do regular things, and it works against different pathologies. So now some words about health. It's a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. So when we speak about health, person should be active, his memory, concentration should be normal. This person should be adopted for social life. If something not correct, we can't say that person absolutely healthy. The main health criteria include level of function and reserve capacities of main physiological systems of the organism, level of immune protection and of non-specific resistance, present or absent of chronic condition or development defects, level of moral and motivation. So, by World Health Organization, lifestyle influence on health more than 50%, particularly 51% of our health depends what is our lifestyle, what we eat, what we do, how we react to different things. But healthcare system influence on health of population only 10%. So we can't say that only in rich countries people are healthy, but in poor more people suffer from some pathology. The ratio between non-infection and infection disease will be different, but mostly what person do for his health more important in compare how often he will go to doctor. But that's also very important. So speak about lifestyle is very important, and really it can cause if lifestyle will be not rather healthy, it can cause a lot of damage. So, in other words, lifestyle is complex of interests, opinions, behaviors of person, group, of culture, or in other words, the way in which person or group lives. For example, when we speak about lifestyle, some economic situation, standard of living influence, social, psychological, socio-economic influence, and all of this influence on quality of life. Quality of life is individual perception of their position in life in the context of the culture and value system in which they live and in relation to their goals, expectations, standards, and concepts. So, another way, it's subjective, absolutely subjective analysis, how person understand his level of living, possibility to function, to be in society. So some disease not influence on quality of life or influence very light. Some disease decrease quality of life. Sometimes when we prescribe some treatment, just treatment decrease quality of life. So sometimes treatment can decrease quality of life even more in compare with disease, and we should remember about it. For example, in this picture you can see how we analyze the quality of life in patient with some disease. In this picture it's with rheumatoid arthritis. Smaller, yes, with blue lines. This is the quality of life rather small. Patient before rehabilitation, the red one is after rehabilitation, and you can see the white diameter, yes, violet. This is quality of life people without this pathology, yes. So by our manipulation it can become better, but not always return to the normal level. If we speak about healthy lifestyle, it's optimal quality of life, determined by motivated behavior of a person and to save health as long as possible. And criteria of it. Firstly, we speak about prevention behavioral activity. Person control his health. This is also safety rules. Yes, physiological optimal mode of work or rest. Person go to sleep at night but not sit on telephone or computer till morning or something like this. It's normal level physical activity. It's important what we eat. Avoidance of harmful habits, smoking, etc. And look, nowadays when everything's so fast, when it's necessary to be in different places in the same moment, to read more, proper rest is very and very important. So, I told you about some criteria of healthy lifestyle, and we will start from one of the most important factor. This is physical activity. When we analyze physical activity, it's important to note that we should analyze not only time spent on sport, but also you should understand that if you do some exercises during 1 hour, but then you go to sofa and your lifestyle is sedentary, it will be not rather healthy for you. So it's very important not only do exercises when you go to gym or something like this, but it's important to be more active during the day. Because nowadays I see that rather often regime of the day is something like wake up in the morning, drink a cup of coffee, go to bus stop or drive a car, go to office or university, sit in several hours, mostly more than 7 hours, near computer, yes, maybe speak with somebody, but sitting. Then several hundred meters to bus stop or car, then you go to home. Not even walking, but drive car, yes, and then again have a dinner and go on sofa watching TV or playing some computer games. So just surfing in internet and social networks and so on. So sedentary lifestyle, even if you do some exercises, it's really not enough. You should be rather active during the day. Physical activity, any bodily movement produced by skeletal muscles. That requires energy expenditure, including activities undertaken while working, playing, carrying out household chores, traveling, doing some sports, and so on, so on, so on. If we speak about an activity when persons suffer from hypodynamia, not enough physical activity, it's one of the 10 leading risk factors for death worldwide. People suffer from cardiovascular pathology earlier. Diabetes happen more often. Osteoarthritis develop more often among people who not do enough exercises. Nowadays, just imagine 25% of adult people not active enough. So it's very important to remember about it, that you should be rather active and analyze yourself. Look, if you spend most part of the day sitting on the table with telephone, computer, when you're so young, it's really terrible. So, physical activity shouldn't be confused with exercise. Yes, exercises, this is physical activity, but we include also another type of activity. If you do housework, it's also physical activity. When we speak about this topic, we should remember that there are different types of it. For example, aerobic muscle strengthening, which can be vigorous or moderate. So, for example, when we speak about swimming, hiking, bicycle riding, when you play tennis, this is aerobic. When we speak about stretching, yoga, yes, it's for our flexibility. Maybe it will be not aerobic, it will be not dynamic exercises, but it's also rather important, especially for our joints, muscles. Um, here it's very important to combine. Visuals are moderate is how intensive it is. So how we can say that it's enough activity for this person? Either is hypodynamia or everything is normal. If we speak about adult people, so older than 18 but younger than 64, persons should do at least 150 minutes of moderate intensity physical activity through the week, or at least 75 minutes of vigorous intensity physical activity through the week. Plus another level of activity. So when you're just working but your pulse not increase, it's not such exercises which is necessary. For additional health benefits, adults should increase their moderate intensity physical activity to 300 minutes per week or equivalent. Plus to this, muscle strengthening activities should be done involving major muscle groups at least 2 times per week. For people older than 65, we recommend at least 150 minutes of moderate intensive physical activity through the week. But types of these activities should be a bit more safer. Those with poor mobility should perform physical activity to enhance balance and prevent falls, 3 or more days per week. Muscle strength should be even more common in compared with younger people. If a person has any disease, the type of activity can be changed, but activity should be. Regular physical activity of moderate intensity, such as walking, cycling, doing sports, but with normal speed, It's really influence on our health. At all ages, the benefits of being physically active avoid potential harm, for example, through accidents, some broken bones and so on. So even people older than 65 who are in higher risk of osteoporosis and broken bones should do some type of activity. Some physical activity is better than doing none. If person can't do a lot, it's better do at least something than not to do anything. Please remember about it. Regular exercises improve muscular and cardiorespiratory fitness, prevent cardiovascular pathology, stroke, diabetes, some type of cancer, depression. It's improve adaptation for our immune system. It means that person who do regular exercises suffer from infection disease not so often. Improve bone and functional health, so it's prevention of some pathology and broken bones. And surely it help us to control our weight and be more, have more energy for doing other type of our work. So how we can analyze is it moderate or vigorous? By heart rate. Normally, when we speak about moderate physical activity, we calculate it in next method. 220 minus your age is the maximal pulse, and it's really necessary not do anything when you pulse higher. Then you have this number of pulse. For example, 220 minus 20 years old, for example, it's 200. It's a maximal pulse. When we speak about moderate, it should be between 50 and 70% of the maximum. So here it will be about 140. It's 70-85% is only for rather nice training people can be. So moderate activity, it's normal. But if person use some drug which decrease heart rate, for example, beta blocker or if receptor blocker, this method can be used or will be non-objective. Also, without calculating pulse, if person can do exercises and speak by sentences, this is moderate. But can't sing, yes? It will be not enough for briefing for him. Visualize some words, it will be by phrases, not full sentences, because it's rather difficult to brief. On the slide you can see some types of exercises which usually moderate intensity and some which are vigorous intensity. For example, walking fast, doing water aerobics is rather nice for our joints and cardiovascular system. Riding bike, playing double tennis. This is mostly moderate intensity, but again, this depends on the speed, how fast do you do these exercises. If you speak about jogging or running, swimming rather fast, playing senior tennis or squash, usually this is vigorous. If you speak about muscle strength activity, if you go to gym and work with weights, lifting weights, this is such type of activity. Working with resistance bands, when you use your body weight for some exercises like push-ups, sit-ups, and so on. Even when we speak about heavy gathering, it's also this type of activity, yoga, and so on. Next moment which we should discuss, this is about our nutrition. Healthy eating is a physiological balanced diet of healthy individuals based on their sex, age, nature of work, and other characteristics that ensures healthy preserved with high workability and active longevity. So in other words, food ration, scheduler, condition of taking meals should be normal. Food ration is composition and amount of food used during the day. This ratio should be different among different people. It depends what weight of this person, what level of activity of this person, Even environment condition influence. Energy value of food eaten should be at least equal to the energy we spend. If you overeat, it's not even with healthy food, it will be not rather nice for your organism. Proper chemical composition, optimal amount of nutrition, we will speak about it. Also, it's rather important that our food should be variable. If you eat healthy food, but the same products every day, it's not rather nice. In this case, you will not take all amount of vitamins, minerals, amino acid, and so on. Good digestibility of food. Fried food is not rather nice. And surely, food should be rather tasty. If it's if you dislike this type of food, it will be not rather nice for you. Energy requirement. There is such thing as basic metabolic rate, which means 1 kilocalories per every kilogram of body mass during 1 hour. So plus some coefficient depending of your weight, mass, gender, type of activity. Usually it's less than 2,000 kilocalories per day among adult, but it's better to calculate because surely basic metabolic rate among girl with 50 kilogram will be different with men whose weight 100 kilogram and so on. And it means that enough energy for girl will be not enough for this man and so on. Just energy usage, for example. If you speak about fat, it should be less than 15%, protein 30-40%, vegetables at least 60% of calories per day. And also we should remember about energy which we spend when we do some exercises. Sometimes it can be even very big. So depending, are you lazy or you're active, amount of calories which you should use can be different. So here on the slide you can see a different group of people whose coefficient of basic metabolic rate will be different, depends what type of activity they do per day, what about their work and so on. When we speak about chemical composition, we speak about protein, fats and oils, carbohydrates, minerals, vitamins and water. Balance normally should be about 1 of protein, 1 of fat and 4.5 of carbohydrates for most of us. Only for people who do too much sport it can be a bit different. Then balanced amino acid is also rather nice. We should use more oils than fats and use enough vitamins and minerals. Daily recommendation of protein usage is 1 gram per every kilogram of body mass. So if your body mass 70 kilogram, you need at least 70 gram of protein. If you do a lot of sport, more than 1 time per day or more than 5 times per week, this dose can be about 2 grams per every kilogram of body mass. For example, if you speak about chicken, there are about 20-25 grams of protein by every 100 kilograms for every 100 grams of chicken. Yes, if you speak about milk, mostly we speak about 10 grams per cup. If you speak about eggs, it can be 8 grams for every egg, and so on. High quality proteins contains essential amino acid, and when we speak about protein rich food, we mostly speak about meat, eggs, fish, cheese, beans, nuts and so on. About fats, it can be fat-like substances which include cholesterol, phospholipids, and can include neutral fats, glycerol, fatty acids. Fat is not our enemy. It's necessary to use fats. Daily recommendation to use about 100 grams per day, or and at least 40% should be oils. Or in other words, there is called good and bad fats. If you speak about fast food, burgers, chips, cakes, and so on, this is not rather good fats. It's not necessary to eat. But when we speak about olive oil, fish, nuts, avocado, for example, these products include a great amount of fat, and it's necessary to eat it. Oil, or in another ways, it's vegetable fats. For example, linoleic, olive oil. It's very necessary to use. It's not increase cholesterol level, but it give a lot of things which is so necessary to our organism. Carbohydrates. There are simple and complexes. When we speak about simple, it includes glucose, fructose, galactose, and so on. We should avoid a big amount of food with simple carbohydrates. But when we speak about complex, it gives us feeling that we are not hungry for a very, very long period of time, gives a lot of calories, fibers, and believe me, you will not increase your weight if you eat 400 carbohydrates per day or even more if you speak about complex carbohydrates, not simple. So, about eating condition. It should be short rest before eating and some after. Don't don't watch TV or another programs on your computer. Sitting on table, not running and eat. Then, when we speak about eating schedule, it can be a bit different, depends in what time you wake up. Or it's more comfortable to wake up for you in what time. If you speak about lives, people who wake up early and go to bed, not rather in the evening, but not in the deep night. Such people should use about 30% of calories during breakfast, about 20% during lunch, 40% during dinner, and 10% during supper. But if we speak about oils, when people prefer to wake up rather late and go to bed in the late night, for breakfast it will be also 25-30%, but for lunch it will be a bit more, about 40%, not on dinner but on lunch. And dinner a bit lower, about 25%, and supper 10%. Some healthy eating rules for people with to save their health. Energy intake. Calories should be in balance with energy which we expend. If we want to decrease our weight, we should decrease the amount of calories. If we want to increase our weight, we should increase it. So it's rather simple. There are no bad or good calories or good or bad products. If you eat a big amount of calories, wait that your weight will be higher. Increase consumption of fruits and vegetables. At least 400 grams of vegetables per day should be used, but also grains, nuts should be used. Limit intake of free sugar, less than 10% of total energy intake during the day. If it's possible, not add sugar on tea, coffee, or something like this. Believe me, you eat a lot of simple carbohydrates during your day, even without adding it. Total fat should not exceed 30% of total energy intake, with a shift in a fat constipation. So, keeping salt intake less than 5 grams, but it's better even less than 3 grams per day. If persons suffer from cardiovascular disease, hypertension should be even lower, because high dose of salt increase risk of cardiovascular pathology. And decrease cholesterol intake less than 300 milligrams per day. So it was about healthy nutrition. Now we will speak about main risk factors. What does it mean? We speak about different habits conditions associated with increased risk of disease or infection. Risk factors can be modifying and non-modifying. Non-modifying is our gender, our age, some genetic predisposition. So something which we can't change. Yes, modifying it means that it's changeable. We can influence on it. For example, some habits: smoking, overeating, alcohol usage, low level physical activity, chronic stress. When we see some changes in analysis, dyslipidemia, high level of glucose, and so on, these risk factors can cause some pathology in future. Bad habits: smoking. It's one of the most common risk factor, which is rather difficult to change. Nowadays, there are no people who don't know that smoking is rather bad for our health. It can influence on respiratory gastrointestinal disease. It can increase predisposition to ulcer, cancer. It can cause prostatitis. It increases cardiovascular pathology. People suffer from stroke more often. And usually people who smoke live shorter in compare with people who not. About alcohol abuse. About 10% of death caused by alcohol usage. Alcoholics, people who have such abuse, live 15 years less in compare with people who doesn't drink alcohol too much. Alcohol usage is a risk factor of neurological, cardiovascular, gastrointestinal, urological diseases, increased risk of trauma, also risky sexual practice increase, and some infection also can be caused by some risky behavior. Chronic excessive alcohol use can wreak particular havoc on the brain, increasing the risk for dementia, stroke, and physiosocial impairment. So, the risk influence on brain, on our predispositions to some disease, improved insulin sensitivity is one of the good moments, yes, but there are so many bad moments that all good effects just disappear. So it's also about some effects of alcohol. Look, nowadays there are some information that not regular light dose of alcohol even can decrease the risk of hemorrhage stroke, for example. Some research shows that light dose can decrease cardiovascular pathology, but when patients start drinking regularly, not like small dose several times per month, it causes serious mental pathology. And especially there is a very bad effect of alcohol to children and teenagers. But a lot of young people want to show that they are adults and show it for their company, and they start drink alcohol at 10, 12, 14 years old, and surely it can cause a very severe complication, especially for children and teenagers. Our psychological status can be changed. It can increase our sensitivities to stress. Rather often, people start drink after some stress situation, but really, it's decrease our sensitivity for a very short period of time. But then, stress became even more severe, and surely it's not rather nice. About physical inactivity, it's also another risk factor of disease. We discuss it. Emotional stress. So really, there is even such proof that most disease from stress and only some from life. Surely a joke, but if persons suffer from severe stress and it's constant, is the risk factor of ischemic heart disease, peptic ulcer, is the risk of depression, anxiety disorders, and surely it's not rather nice. We should fight against stress. Maybe the word is not rather correct, more relaxed, and not take everything to our heart. Body mass index is also another risk factor. Nowadays, we see that overweight and obesity became so common that even among children at school, about 15% children suffer from overweight and obesity, even in childhood when people are so active. Normal body mass is between 18.5 to 24.9. Everything that less is deficit of weight, everything that high is overweight, and when body mass index more than 30, we speak about obesity. Body mass index calculated like body mass to height, um, and one more time, it should be between 19 and 25. If it's more, we speak about overweight. More than 30 is obesity. Between 30 and 35 is the first class of obesity. 35-40 the second, and more than 40 is very severe extreme obesity, the third class. Also, it's rather important to measure the waist circumference. For men, it should be less than 95. For women, less than 80 centimeters. If it's more, the risk of diabetes, insulin resistance, hypertension became really high. Also, waist-hip ratio. For men, it should be lower than 0.9. For women, less than 0.8. In another case, this is a risk factor of metabolic syndrome, even if body mass index is normal. So waist circumference is very important parameter which show predisposition to some disease. Okay. If person suffer from overweight, even not obesity, risk of coronary heart disease increase in 2 times. Risk of diabetes increase in 8 times for women. For men, it's a bit another, but also the risk higher than normal. Risk of hypertension increase particularly in 3 times. Lithiasis also in 3 times. So even overweight can cause a lot of pathologies. So here on the slide you can see that obesity influence on another disease development. You can see how much pathology can appear just because there is overweight and obesity. By increasing fat stores, our metabolism changed. Inflammation appears. Person suffer from infection more often. We see dyslipidemia, high blood pressure, cardiovascular pathology, arthritis, thrombosis develop, and it's by itself it causes another disease. Sometimes obesity not result of our nutrition, but caused by some disease. Mostly we speak about some hormone problem or sometimes drug usage, but most cases it's not the main reason of this changing of weight. Mostly it's associated with nutrition. Another risk factor is hypertension. About 30% of adults suffer from this pathology when blood pressure higher than should be. Hypertension is a risk factor of cardiac artery disease, brain pathology, retinopathy, nephropathy. It's an increased risk of vascular pathology, in particular in 5 times. And it's very important. If person already suffers from hypertension, it's necessary to control level of blood pressure and use special drug. If we speak about dyslipidemia, high level of total cholesterol increase risk of ischemic heart disease in 4 times, particularly increase risk of death 4 times. So it's rather necessary to control what level of cholesterol, level of low density lipids and high density. If ratio is not rather nice, it also can influence on atherosclerosis development. Glucose level, diabetes mellitus, also rather severe and major risk factor of ischemic heart disease, kidney pathology, damage of vessels can be caused. So control the level of glucose is very, very important. So the quote of the day of our lecture: if you don't find for what you want, then don't cry for what you lost. So if you don't do anything to control your diet, if you don't do any exercises, if you just spend your time laying on sofa, watching TV, eating fast food, if you not control your body mass, not control your blood pressure, don't cry if you lose your health and start suffer from some pathology. So, thank you for your attention. I really hope that it was interesting for you, and see you later.